Welcome, everyone. Thank you for signing up and joining us today at our E.R. Brown Symposium, which celebrates our 30th anniversary.
A big part of the work that we do at the Center for Health Policy Research is producing research and data that's policy relevant. And we share this information widely so that it can be used by people, communities, advocates, policymakers to shape effective policies and improve programs.
I believe that the UCLA Center for Health Policy Research exemplifies putting this commitment in practice, given its scholarship, teaching, and commitment to enhancing health equity.
This center was one of our co-founding partners in helping us develop an approach to modeling the cost of proposed legislation when CHPR was first launched in 2003. We impact policy by informing, elevating the debate, and supporting evidence-based decision-making.
We are honored to be stewards of the California Health Interview Survey, and we're excited by the possibilities for the future. The CHIS has generated valuable knowledge about the health and well-being of California's diverse population.
If you don't exist in the data, you don't exist in the eyes of the decision makers, the policy makers, those with the resources to assist our communities.
Bringing that voice of the community to those policymakers is a very important piece of how we impact policy and really affect change, not by just what's written in a book, but what's by happening in practice in the community.
Democratizing data comes in many forms, but at its core, it's designed to put data in the hands of those who most need it and to accelerate the translation of data to action. Community engagement is essential to the realization of this vision, and our students are essential to the sustainability of these efforts as they become our next champions and leaders. The Health Equity Challenge is just one example that brings these ideals together.
We continue to examine the impact of healthcare system reforms and health policy, and we want to continue to expand our collaborations within and outside of California.
This really is your moment. Your work can help build a system that is not only more effective, but is more inclusive, more just, more equitable, and more humane. Seize it, because the future of health and healthcare depend on what groups like you do next.
I hope we can collaborate with you. I hope you heard the stories, the resources, the connections that we have at the center. So thank you to everybody.